Thank you for taking some time to watch this presentation for Lifelines schools about what parents and guardians need to know about youth suicide prevention in our schools. I'm Marney Rohda, and I'm joined today by Maureen Underwood. Maureen is a licensed clinical social worker. She is the lead author of the Lifelines trilogy and has been working in the field of youth suicide prevention since the 1980s. Maureen, do you want to get us started?
Thanks, Marnie. I want to welcome you all as well and tell you, unfortunately, some of the greatest wisdom that we have in the field of youth suicide comes from parents who've had children who have died by suicide. And this happens to be one of those parents. Why talk about this, he says, because we teach our kids about seatbelt safety, to stop, drop, and roll in case of fire, about the dangers of drug and alcohol use, about safe sex practices, yet we don't address what the second leading cause of death is in our youth, and that's suicide. He often says that perhaps if he had known what he learned after his daughter's death, maybe she would still be alive. But he knows enough to know that it isn't quite that simple. And he understands that suicide isn't about parenting. This may be one of the biggest myths that exist. Suicide is a really complicated problem, and there's lots of different things that combine to make someone feel suicidal. If it were simply about parenting, there'd be anti-suicide parenting courses. There'd be a quick fix to this, wouldn't there? But there aren't courses like that. But where parenting does come into the equation is in your ability to help your child. And Marnie, tell us the information we're going to be sharing today that may assist in that.
Yes, we've organized our presentation into 5 important topics. Those topics are why youth suicide prevention is important, how to recognize the warning signs, what your school is doing for prevention, what are protective factors and how to foster them, and finally, what to do if you're worried about your child. Maureen's going to get us started with that first topic, why youth suicide prevention is important.
Well, you know, what I want to say is since you've decided to listen to this, you probably already understand why this is an important topic, but let me just give you some of the facts about it. First of all, it has become the second leading cause of death for 10 to 24-year-olds. The rate for attempts in the 5 to 11-year-old group has been increasing, especially in the last year. There's been some data from emergency departments that have shown kids as young as 5 coming in with suicidal ideation. So the age has gone down. There's been a dramatic increase in attempts for those 10 to 14-year-old girls. In a 15-year-old period, that went up 200%. And finally, and I think that this is the only reason that I could have done suicide prevention for as many years as I have, is I truly believe prevention does work. Most people who think about suicide don't die by suicide. That's what we know from prevention. And our job is to try to help those who are on that edge and may not look back. But what we want to do is kind of start by giving you some information about suicide in schools. And a question we often hear is, can't talking about suicide plant the ideas in the mind of vulnerable kids? I mean, you know, their friends can plant ideas for everything. Well, the deal about this is it depends how you talk about it. If you're not sensational, if you're not glamorous, if you don't show methods, when it's talked about in small groups, like in the classroom, not in an auditorium. And the thing that's important to know is there's a percentage of kids who are thinking about suicide already. It could be as high as 30% of kids in a high school. So what you do by talking about it is give them permission to share those feelings, and they don't have to keep them secret. As you know, the things kids keep secret can be the things that really are the most destructive for them. You may have also heard, though, that talking about suicide is just a way to get attention. And you're probably going to be surprised at our answer to this, because the answer is yes, it is. But what we're going to say to you is it's the same way someone who's drowning yells help to get attention. It's asking for something rather than acting on something. And this is just such a healthy thing to do. We have to understand if someone keeps talking about it, somehow the reasons they're talking about it haven't been addressed. So that's always what it tells us. Finally, there's a question about, is it safe to talk about suicide in schools? And I think it's how it's talked about is what makes it safe. The Lifelines curriculum you're going to hear about in a little bit gives information to kids, gives information to everyone in the school community, including you. But what it does is it gives information with direction of how to use that information. And especially in the Lifelines curriculum, there's a big focus on where to get help for yourself or a peer. And it isn't just a friend, it's a peer, because we want to make sure kids are watching out for those isolated kids who really may be more at risk and they're not connected with anybody. And why it's important to talk about it, this goes back to something I just said a second ago, but I want to reinforce, is that we know at least 30% of kids who are thinking about suicide are going to tell somebody else. So what this tells us is they're not only thinking about it, but they're talking about it already. So wouldn't it be nice if we could increase that percentage to have more kids who were willing to tell someone else? And that's what Lifelines is designed to do. The other thing Lifelines does is it presents us with what we call a public health model of suicide. And we don't talk about mental health or mental illness because I think that gets us into complicated, deep water, and it can be very confusing. And this definition is a behavioral definition of suicide. It comes from one of the pioneers in the field of suicidology, so it's very grounded in theory, but it translates suicide into words that are easy to understand, even for young kids. Suicide is an attempt to solve a problem of intense emotional pain with impaired problem-solving skills. So you see the three parts there. There's that attempt to solve the problem, there's that emotional pain, and the impaired problem-solving skills. And it leads us to a simple question: what's going on in your life right now that has you feeling so terrible you wish you were dead? And you'll notice I didn't even use the word suicide in any of that. We see suicide as a child or an adult not being safe with themselves. That's a lot easier to say sometimes. I'm worried you're not safe with yourself, rather than saying, I think you're suicidal. So I'm just sharing with you some little tricks we've learned through the years to make this an easy conversation. Warning signs are something that are important to recognize, but we want to distinguish them a little bit because there's often a little bit of confusion between warning signs, risk factors, and often people neglect what may be the most important part of this equation, which are the prevention factors or the protective factors. So what we've done is we use a traffic light to help us make clear there's a difference between suicide risk and warning. And again, that green light, which we're going to come back to later, that's really important because that's where the prevention lies. So let's look at that amber light, the risk factors. These are traits, attributes, characteristics, or any other kind of variables that would increase the risk for suicide or suicidal behavior. And these include things like having a family history of suicide, a mental health diagnosis, making a previous attempt, exposed to the death of a peer, some of those kids who are self-injuring or non-suicidal self-injuring is what we call it, or have access to lethal means. Now, let me just say, risk factors for suicide are similar to risk factors for heart disease. As you know, there are some identified factors as risk factors for heart disease, aren't there? If you're overweight, you drink, you smoke, you don't get much exercise. The deal is, though, even if you have those risk factors, it doesn't mean you're going to have a heart attack, does it? It just means your risk is higher than the general population. So what we know for kids is that even if they have these risk factors, it doesn't mean they're going to be suicidal. And that's what's important to know. It just means that they have a predisposition. Their risk is a little higher than the general population. Warning signs are something that are a little bit more serious. And we've organized these under the acronym FACTS. That stands for feelings, actions, changes, threats or talk, or situations. And what I want to point out to you is the things on here that are really, really important is obviously if you have a child who's threatening harm to themselves in any way, shape, or form, that's a kid that you want to worry about. Or they're talking about not being around or not having any purpose in life, all of that sort of stuff. The feelings are feelings you probably couldn't, sort of assume, being hopeless and helpless and worthless. And the actions often are risky behavior. Sometimes they include things like looking for ways to die online. But what I think is the most important thing to point out are the changes, those C's. And those are changes that you notice as a parent in as little as 2 weeks. So it's a small window, but it would be a change that seems pretty consistent, because I know kids go up and down and up and down and up and down with moods. And if you clocked every change, you probably have a calendar that's got check marks on it all the time. But what you're looking for are specific changes, and they're changes that have taken place in as little as a 2-week period of time. So what we wanted to share with you are some of those warning signs you may notice at home. What I'll tell you, there's a lot of programs out there that talk about suicide prevention, but often they're showing you warning signs for adults. There's not a lot of them that talk about warning signs for kids. So that's another thing that we do differently. Those changes in appearance, and again, you have to kind of know your kid. I certainly know that, 10 years ago, maybe 10 years ago, if I had a child who wanted green and yellow hair, I might have thought there was something the matter with them. Today, it's maybe they just want to fit in. So you have to kind of take a look at the temper of the times to see what those changes in appearance look like. The clothes, kids who look like they shop at the thrift store and probably do. These days, that's pretty normal and it's pretty cool. 10 years ago, it wouldn't have been. Those changes in mood, and I think it's important to recognize that sometimes it's not just a kid, starts to seem down or depressed. They may become cheerful. I haven't seen it a lot, but it has happened where kids who finally decide they've had enough, they have a plan and they're good with it. With boys in particular, you want to look at increases in irritability, in anger, hostility. I've heard lots of parents who have lost boys to suicide talk about that. Those changes in eating and sleeping, again, you have to monitor those in terms of the normal behavior of your child. Losing interest in activities they used to enjoy. That's an important one. Quitting sports teams, withdrawing from friends, not wanting to listen to music even. That's something that really should get your attention, because those behaviors are often the things that help keeps kids' heads above the water, so to speak. And if they don't have those anymore, they may be losing their interest in living. They may start bullying members of your family, or you may see them bullying some of your pets. Those somatic complaints, kids who can't sleep at all, or just could sleep all the time, or you wake them up in the morning and they're exhausted because they haven't got restorative sleep. They may be sleeping, but it doesn't restore them. And as I said before, those actual threads or notes, and these could be on a computer, so you do want to pay attention to that. Or if some of their friends reach out to you and say, we're worried about your son, we're concerned about your daughter, do you think maybe we could talk to you about it? Talk to them, find out what they're seeing, and take it seriously. Now, Marnie's going to shift, and she's going to tell you about what your school is doing for the Lifelines Prevention Trilogy. Marnie?
Yeah, so we're going to move on to that third topic that I mentioned earlier, which is what your school is doing for prevention, which is offering the Lifelines Trilogy. I want to start with a quick introduction to Lifelines as a program. As you can see, it is a comprehensive program, which means that it takes into account and works with the entire school community, starting with administrators, working through faculty and staff, students and parents, as well as sometimes the larger community as well. That comprehensive approach is also evidence-based, And as Maureen has already mentioned, uses a public health prevention model as opposed to a mental health model. And finally, the program is sustainable. It's designed to last in the school and having a difference in the school community over the long term, which is all to say that your school has chosen well by choosing Lifelines. So a little bit about it. When it comes to prevention, the goals of the prevention component are really straightforward. It's as simple as this. Everyone in the school community will be able to know the warning signs of suicide, be able to identify students with those warning signs, and be able to make effective referrals to get assistance for those students. As I just said, that school community has a pretty wide definition. We consider it in Lifelines a competent school community to include administration, faculty and staff, the students, sometimes a really underutilized resource in school communities, parents and guardians, that's why we're talking to you right now, and also the larger community at stake, for instance, the Mental Health Association of Monmouth County's involvement in your school's Lifeline program. So what happens for a school to be able to offer the Lifelines program is they receive extensive training and then do training on their own. So what happens for prevention is the faculty who will teach your prevention curriculum, which is oftentimes your health or PE teachers and sometimes school counselors, are trained on the student curriculum and how to implement it. In addition, every single member of school staff receives a training on suicide awareness and prevention, so they're familiar with the Lifelines model and languaging. Then, like right now, parents and guardians receive a training on suicide awareness and prevention, so you're on the same page. And the final step is when students participate in the suicide prevention curriculum themselves, once the rest of the community is ready for them. And the primary takeaways of the Lifelines curriculum that students are going to get, and you see how simple these three concepts are. These are the things that students learn. They learn concepts of social connection, help seeking, knowing how to access in-school resources. And what I want to say is that Lifelines incorporates with these the two most significant protective factors for youth, which is feeling connected to family, school, or community, and being able to identify trusted adults to whom they can turn. You see the help seeking part and the knowing how to access in-school resources takes into account those trusted adults and getting help. And the social connection part gives them that protective factor of being able to feel connected at family, school, or in their community. Now, the nuts and bolts of the curriculum, in case you're wondering, well, what does that actually look like? It's really straightforward. In 5th or 6th grade, students receive 4 45-minute lessons. And those 4 45-minute lessons cover main topics of helpful problem solving and how to understand the difference between doing helpful problem solving and unhelpful problem solving. Asking for help, and here the asking for help part is really where we help students redefine the concept of asking for help as something that is brave to do. Asking for help takes courage is something that is taught in the curriculum. And finally, of course, as I've mentioned, that trusted adult component comes into play right away in 5th or 6th grade. Then in 7th to 10th grade, sometime in that span, students receive 4 45-minute lessons again. Those 4 45-minute lessons cover those facts, which Maureen just taught you about. We teach students about those facts. They teach students intervention steps, meaning what to do if one of those students, someone you know, a peer, is displaying signs that they're concerned about, is displaying those facts, what to do, what to say. We teach those 7th through 10th graders how to identify helpful people, that's the trusted adult idea, and to make sure they know what resources are available in your school to support them. And finally, we've added 2 45-minute lessons that are taken once in 11th or 12th grade. And this is really a transitional curriculum, which is helping students get ready for the transition from high school to wherever they go next in their lives. They start out by reviewing those intervention steps they learned in earlier grades, and then they spend a great deal of time talking about the expectations and assumptions they might have for life after high school, and start to look at what might happen if their expectations or assumptions don't work out the way they thought. And as part of that, they look at their support systems now and how that support system will change so that they can continue and be prepared for having connection post high school. And I have one just bit more thing to say before I turn this back to Maureen for the fourth topic of the day. That is, I want to underscore the importance of trusted adults in the Lifelines curriculum. It's really designed to help students identify trusted adults that they can turn to. And to do that, we ask students to name the qualities they look for in a helpful or trusted adult. We don't tell them and define it for them. We ask them to think about what they think about when they think of someone who is helpful or trusted, and write down, identify those qualities. And then we ask them to name people in their lives who meet those qualities. So it's really student focused. And I think that is an essential component of the Lifelines curriculum. It was really made with students in mind. And the final thing I want to say is that, why 2 trusted adults? Why saying 2 trusted adults? We say 2 or at least 2 trusted adults because we know that students live in the real world. And if their trusted adult happens to be someone at school and they're at home, they might be in a bind to be able to reach out to someone. And likewise, if their trusted adult is someone at home or a family member or a relative and they're unable to reach them, they might need to have someone closer to them. So it's good for students to be able to have several and know how to reach them when they need them. So I'm going to give this back to Maureen now to talk more about protective factors.
Yeah, that leads us into protective factors because trusted adults are protective factors. Remember when I told you a while ago about the green light? And this is so important because this is the hopeful news about suicide, is that we all have what are called protective factors, even those of us who are adults. And these are behavioral, personal, situational characteristics, and they make us resilient, but probably what they do even more is they buffer us from stress. They're like, I call them the bumpers on the car of life. They absorb the shock of the dings and the crashes we sometimes have because they don't hit us quite as badly. And it's important to understand, we know that, even when you're the most mentally healthy person in the world, there may be dings and crashes. So this says what you need is something to protect you from the shock of it. Some of the other protective factors for youth, in addition to that contact with a caring adult that Marnie just mentioned, actually those 2, and these come from research, okay? Having a sense of connection. Again, you can see Lifelines reinforces that. And that's connection at home, at school, church, community, even your peer group, so you don't feel alone. Obviously, having positive self-esteem and good coping skills are protective factors. Some of you may say, are you kidding? There are teenagers who have that. And there maybe not so many of them, but there's some teenagers who have that. And the next one I think is, I just think this is such an important way they worded this. It's having access to care for emotional, physical, or substance abuse problems. It doesn't say you don't have problems. It goes back to what we talked about. But the protective factor is you get care for those problems. So it's a recognition that life has problems in it. None of us get through problem-free. But as long as we can take care of those problems, we're going to be okay. And then, of course, there are cultural and religious beliefs that really promote self-preservation. And that's an important thing to see as well. But what can you do as parents to foster protective factors? Well, one of the things, and I think that you could see Marnie talk about this in the curriculum, is teach your kids it's okay to ask for help. In that 5th and 6th grade curriculum, we talk about the bravery of help seeking. It's a brave thing to do. It takes courage to ask for help. We acknowledge that. And when you can acknowledge that what you do has some personal value, that you're really doing something that you didn't know you were doing, it can make it a little bit easier to do something that's difficult. What you want to give kids permission to talk about traumatic events like suicide. And what we suggest in doing this is you tell them how you feel first. If there's been a death in your community, a death in national news that's got their attention, for you to say, I just heard about Mrs. Maloney's death, and I'm really struck by it. I don't even know what to say. It makes me really sad and upset. How are you feeling? So it's a lot easier if you're willing to be vulnerable first, and then you can let your child be vulnerable. You want to help your children identify those trusted adults, and you need to be okay if it's not you, and it may not be you. I remember when I asked my son this question, and he told me it was his aunt and it wasn't me. I was a little insulted, but at least he had somebody. Encouraging that participation in school and community activities is really where that social connection comes in, and acknowledging your child's efforts. It's pretty easy to do when a kid gets good grades. It's easy to say, hey, A+, you did good. It's when a child gets a D+ or a C. That's when it's so important to let them know you're going in the right direction. What can we do to help you move that way? And being a good listener as often as you can. I have a 3-time rule. I'll listen to the same story 3 times, and then I will tell it back to you as you begin. Wait, isn't that the story you told me about your friend? Oh, yeah. So to show I'm listening. But again, most kids don't think adults listen to them. So if you're listening, that's a big plus. Other ways to encourage protective factors. And this first one is really how you reinforce resilience and diminish dependence, encouraging problem-solving skills, even when the problem-solving skills aren't the best. I tell the story about my granddaughter making a cake the first time, and more of the cake was on the floor than in the pan. So when it came out of the oven, it was maybe about this thick, but that was such a good cake. That was wonderful. She was learning how to be independent. You got to let kids make mistakes. And this often takes the form of, I forgot my homework. I didn't give me my lunch. Do I have my gym shoes? And it's like, I guess you don't have them today. You'll remember next time. Letting your kids learn from experience. This academic year in particular, we're suggesting that you really try to find that balance between academic standards and emotional health. Because of the disruption in the last year and a half, kids have emotionally suffered a lot, as well as academically. So really kind of balancing a little, that's what we talk with teachers about as well, is, how to know when you can loosen up on an academic standard because the emotional health may be more important, and talk about and demonstrate the importance of flexibility. If there's anything that we learned in the last year, was how to be flexible. And if you didn't, you were in sad shape. So I think it's important to name it. One of the things we know about children is they have very limited feeling vocabularies. So if you can name what you're doing and what they're doing, is, we've learned how to be flexible. We thought we were going to take a vacation to here, and we wound up, we had to have a stay vacation at home, but it was still okay, wasn't it? Maybe not as much fun, but it was okay. So giving them examples so they can really connect with that concept of flexibility. Talking to your kids about suicide may seem even more challenging, however. And again, one of the things I've just said is you have to tell kids what you think and feel first. And then you can ask them what they think and feel. If they're reluctant to tell you, sometimes I've said, well, do your friends talk about this? What do you hear from them? I guarantee you they're talking about it. Almost all kids are. So you want to kind of pursue that and try to figure out how to get an answer, and listen to what they tell you. And even if they say something that you think, oh my gosh, this is the craziest thing I ever heard, don't disagree with them. Don't minimize it. Basically, you want to just let them know, wow, it sounds like you kids talk about this all the time. And some kids even have talked about how they would do it. Wow, that's pretty scary. And then you see the next point on here. If you hear something that concerns you or scares you, use those 3 magic words. Can you tell me a little bit more about that? I'm curious. This is, again, where you're going to listen. And if your child says something that has you feeling really, really worried that somebody may do something right away, you have to act immediately. And we're going to tell you a little bit what to do about that. So the last topic that we're going to review with you is, what to do if you are worried about your child. And we'll start with that question of, if you're worried that your child might be in immediate danger, they're saying something, they're doing something, you found out something that makes you think they may be at risk for suicide. Oh my gosh. The first thing to do is take a deep breath. And it's not easy, because I think there's nothing more upsetting than hearing a child wants to die. and especially if it's your child or a child you care about. So you really are going to have to just sort of center yourself, and you have to take action right away. You want to pay attention to what's going on with your child, and in particular, restrict access to dangerous objects. If your home has firearms in it, get them someplace else. We're not talking about your Second Amendment rights, nothing about that. We're just saying you want to have dangerous objects removed from the home. It also includes medication, including over-the-counter things like Tylenol. That seems to be the drug of choice that young girls use for attempts. And then you also want to contact your emergency resources, and Marnie's going to tell you how to do that when we come to the end of the program. If the situation is less urgent and you're just kind of, oh, something's not right, I don't know what's going on, and you feel like you need to get help, where do you go? Well, you could check with your pediatrician. You can ask your school counselors. Oftentimes they have a list of referral sources in the local area that they use. They may be even able to make the referral for you, which would, that may deal with some of your anxiety about it. Sometimes you have parents, and I will tell you, wow, there are so many families who have kids in treatment or kids who need treatment these days. I can almost guarantee you that in your friend circle, there's somebody whose child is receiving mental health services. So if you're comfortable and you don't feel too vulnerable, to ask them what they found and what their search was like. And then finally, you can certainly go to your insurance company. They will usually give you a list of mental health professionals. And sometimes you may know who they are, and sometimes you have no idea. And let me just tell you that there are different kinds of mental health professionals. They all have different kinds of trainings. All of the people on here have advanced degrees in different subjects, but what they have in common is the ability to talk to your child, to figure out what's going on with them, and then figure out why they're feeling what they're feeling, okay? So any of these would be good references. If your child needs medication, most likely they're going to need that advanced practice nurse or psychiatrist who can prescribe medication. Some psychologists can prescribe medication too. But if they don't need medication, everybody got kind of the same training, same skills. Before you take your child in, when you call up to see if you can get an appointment, ask these questions. If you were going to buy a used car, you would probably ask, what kind of miles does it have? Have you been in an accident? When do you'd want to know details. These are the details you want to know about a mental health practitioner. And if they say, I don't have time to talk to you about this, they're not the right person for you. They're not the right person for you, because you should be an educated consumer. Do you take my insurance? If you don't, do you have a sliding fee scale? Is there a waiting list? How long is that waiting list? Is there a shorter waiting list for appointments at certain times than others? Do you have available appointments, and do you schedule them on evening and weekends, which most therapists do? And I will tell you, if this is for your child, you want to make sure they do. Do not schedule an appointment with a therapist who can only see your therapist in the course of the school day, and your child has to miss school. That just creates another set of problems. And I have known some people who have done that. What are your emergency contacts? Suppose we have a problem at night, who do we call? Do you involve us, the rest of the family? Are you going to talk to the school? If you think my child needs medication, what are you going to do? And if you think my child needs more service than you can provide, what happens then? How do you handle that? What you're basically asking for is what we call a mental health assessment. And this very simply says it's an assessment that's provided by one of those mental health professionals to see whether your child would benefit from mental health services for any reason. So this may be, your child may not be suicidal. They may have some risk factors. They may not be feeling real well, but they may not be someone who's kind of at immediate risk. So there could be all kinds of reasons that a child would need some mental health services. And they include play therapy, individual counseling, group counseling, medication, and it always is in what's called the least restrictive environment, which is usually outpatient. Sometimes we think our kids would be better in the hospital. I'm not so sure about that. Yes, it would make it a little bit easier for you in the short run, but it may be that your child's in an outpatient setting. And if your child is determined to be at risk, there's some other questions they're going to ask. So let's take a look at what you want to find out if your child is determined to be at risk. You want to ask that provider, well, how did you make that determination? What factors did you include? What do you think the reason is for my child's suicide risk at this point in time? We know that suicide is transient and temporal. That means it comes and it goes. What is it about right now that's making them suicidal that maybe didn't make them suicidal a week ago? Are you going to help my child create a safety plan? A safety plan is a collaborative process between the counselor and your child about things your child can do to empower your child to recognize signs of distress and then what they can do to kind of manage those. Is this person recommending follow-up? You want to ask what you can do to be part of the solution and not part of the problem. How can you assist in providing safety? And what can the school do to be part of the safety net? Because believe me, you need as many people as you can get on board here to really providing your child with safety. And Marnie, I think you're going to review those text lines and hotlines for us.
I am. In Monmouth County, these are hotlines and resources it would be really beneficial for you to be aware of. Some of them you might know about already, some of them you might not. What I recommend is you could go ahead right now and feel free to take a photo of this screen so that you have these resources handy should you ever need them or should someone you know ever need them. You can also obviously enter all or some of these numbers into your phone contacts list. But this goes from Monmouth County specific ones, Monmouth Medical Family Crisis Clinicians and Perform Care Family Crisis Intervention Unit, which is part of the Mental Health Association of Monmouth County. They're all there. And then the national information comes next. There's both the national text line and the national suicide prevention line, which probably you have heard about before. There's also the Trevor Lifeline and Trevor text line, which is more appropriate probably for your LGBTQ plus children. So that's all, those resources are all available. It's good to have them handy should you ever need them. And that wraps up our presentation today. And in closing, I really just want to thank you for your commitment to tuning in so that you can support your children and your community in this important topic. And I'm going to turn it over to you, Maureen, to say goodbye as well.
And my last words are, you know, my wish for you is that you never need this information. But if you do know where to find it. And I just want to thank you for caring about your kids. Take good care.